How's it going, guys? Past level question, pulmonary steps 1 and 2, 34-year-old African-American woman. She has a 6-month history of intermittent dry cough. Father died of alcoholic cirrhosis, age 67. No medications, vitals normal. Serum ALP normal at 100, should be 50 to 150. Calcium 9.7, should be 8.4 to 10.2. Chest x-ray shown. What's most likely seen as patient? Chest x-ray is normal here. Literally just Googled normal chest x-ray. Okay, so it doesn't show you bihilar lymphadenopathy. A lot of students jump on, oh my God, African American woman, 30s to 40s, must be sarcoidosis. It's not fucking sarcoidosis. The reason I threw ALP in here as normal is because every once in a while you can get elevated ALP in sarcoidosis because you can get bile ductule involvement, where you can get increased conjugated bilirubin and sometimes increased ALP, maybe 1 out of 10 questions, but I've seen it. And calcium will be elevated basically 100% of sarcoidosis questions, and let alone the fact that we don't have the bihilar nodularity / lymphadenopathy, so it's not sarcoidosis here. So I'll talk about as we move through. Let's just look at choice A. Decreased PTH, wrong fucking answer. Calcium's normal. Okay, so it's just clearly not a good answer. But I should comment tangentially that if this were sarcoidosis, which it's not, as I said, but if it were, they want you to know it's a down arrow for PTH. It's suppressed, okay? That's hard for some students. I've seen them select up arrow for PTH. It's not up, okay? So high calcium, you be increasing negative feedback. Calcium sensing receptors, the parathyroid glands, and calcium and parathyroid hormone is suppressed in the setting of sarcoidosis. Regardless, wrong fucking answer. Choice B, increased bone turnover, wrong fucking answer. This could refer to Paget disease, Paget, okay? Just not even close to the demographic. Be usually a male over the age of 50, and they'll say ALP is high in 14 out of 15 questions. Calcium will be normal in Paget. That's probably the highest yield point I can tell you for USMLE is that students think calcium's high or something. It's not. Normal calcium, normal phosphate, normal PTH, but isolated increase in ALP 14 out of 15 times. Dude over 50, hat doesn't fit him anymore. It can get tinnitus from narrowing of the acoustic foramina. You can get AV fistulae intraosseous causing hypoxic cardiac failure. Wrong fucking answer. Choice C, increased hydroxylase activity, wrong fucking answer. So this is a slick answer choice for sarcoidosis, which we already said it's not. But when you have the on biopsy of organs, but especially the lungs, non-caseating granulomas, which are composed of activated macrophages called histiocytes, which secrete 1-alpha hydroxylase, which activates your 25 into 125D3. The latter goes to the small bowel, increases calcium absorption, which is why you get hypercalcemia and sarcoidosis, hypervitaminosis D. Wrong fucking answer. Choice D, increased leukotriene activity. Correct answer, because this is asthma. And if you've been following my content, if you've gone through my pulmonary PDF in particular, you'll know that very simple way we're going to consolidate things right now is if the vignette sort of sounds like sarcoidosis, but the chest x-ray is normal or shows mild hyperinflation, answer on USMLE is asthma. Okay, they do this. And there's an NBME question I've sent to students during my personal sessions, and most of the students select sarcoidosis, and it's fucking wrong. Okay, so they'll get a question just like this. It'll be like 34-year-old woman, African American, she's got a dry cough. You're like, oh my God, it's sarcoidosis. And they tell you chest x-ray shows no abnormalities. Chest x-ray shows mild hyperinflation. And then the answer is just increased mast cell activity or increased leukotriene activity for asthma, whereas the increased hydroxylase activity is wrong, or non-caseating granulomatous inflammation for sarcoidosis is wrong. So you gotta just chill the fuck out, and when you see the African American woman 30s to 40s, it's not automatically sarcoidosis. Relax, okay? The leukotrienes, it's buzzy for USMLE. You got the lipoxygenase pathway. Arachidonic acid is the precursor to both the cyclooxygenase, lipoxygenase pathways. Lipoxygenase pathway makes leukotrienes, and then when you bind to LTCDE4, you can get bronchoconstriction. They really like that. Increased leukotriene activity for asthma, obviously, montelukast, ferlukast block those receptors. Xyluton blocks lipoxygenase. Let's just hop through the final answer choice. Non-caseating, histiocytic activities, sophisticated sounding. Wrong fucking answer, Carity. harped on that histiocytes are just another fancy way of saying activated macrophages, but regardless, it's not sarcoidosis. Choice C, wrong fucking answer. You know the deal. Until you make more content of a subscription. Appreciate your time. That's it.